find that adults and children continue to present with very serious and significant mental health challenges. And in addition to the Surgeon General report that Susan cited, the State of Mental Health Report of America in 2022, it uses measures from the United States Substance Use and Mental Health Administration, SAMHSA. It indicates that 50 million of the adult population, that's 20% of adults, struggle with a major mental health condition, and that more than one half of this group of 50 million, that's more than one half, 27 million, do not receive consistent, continuous treatment. And access barriers are a significant contributor to this inconsistent treatment. And these access barriers really arise from the inadequate workforce, the inadequate supply of providers available to meet the growing need in our community. And the picture related to children's behavioral health is similarly bleak, unfortunately. In a 2022 Annie E. Casey report on that compared state data related to children's behavioral health, rates for youth with anxiety or depression increase from 12.2 to 18.4%. And that report and that survey measured pre-pandemic versus post-pandemic outcomes. So that's an increase of 6.2% in presence of anxiety and depression in particular amongst youth ages 3 to 17. So how do we see this crisis at Community Services, and how are we taking it on? So Barbara, if you could help me, would you share just a couple of my slides? Thank you. Our experience at Martha's Vineyard Community Services really reflects national and state trends. We see community mental health needs higher than ever. And at the same time, workforce challenges have forced our programs to downsize. And in some cases, they have come to a screeching halt. I refer to this reality as service and program atrophy. Our child and adolescent behavioral health, behavioral outreach program is a great example of service atrophy. The COVID-19 pandemic essentially decimated this program as families struggled to manage the demands of their work, their families, economics, with children at home. It was a really incredible time for families around this country, and particularly on Martha's Vineyard. And so behavioral health understandably took a back seat when these other priorities were so much at the fore. And add to this mix grave workforce shortages, as well as fatigue among the staff who remained throughout the pandemic and continue to serve at Community Services today. So together here, we have all the ingredients for a community mental health crisis. But today, I speak to you extremely optimistic. Our trends are moving in the right direction. Our efforts to remediate the challenges and artifacts of the pandemic are beginning to take hold. Our strategic actions, as you see on this slide, are set forth in a 3-year strategic plan, and we've just completed the first year of that plan. We're focusing on agency and community collaboration with regards to innovative behavioral health programs. We're rebuilding and fortifying our services, and I'll speak to that a little bit later. And we're investing in our workforce, and we're taking a very strong team and organizational approach that is highly supportive of our valued staff. So let me highlight some key behavioral health developments underway at Community Services. For the last 18 months, we have been remediating this crisis through a host of service innovations at community services. Some of our action has just been, quite frankly, restoring what used to exist that really was significantly impacted by the pandemic, and other initiatives are truly bold and innovative and are paving the way forward for our Island Counseling Center. So to the far left of this slide, we continue to build our child and family behavioral outreach program. As part of this program, we have hired a stellar Yale-educated and faculty psychiatric nurse practitioner with child and adolescent specialization. With Beth Muller now on board at Community Services, we have increased our child and adolescent psychiatry capacity from 16 to 80 hours monthly. That's an uptick of 400%. We've, as also a part of our child and adolescent behavioral health program, we've developed a collaborative and integrated model with the Martha's Vineyard Public Schools, and we hope to launch this model later this fall. We've been at it for about 10 months in designing and building the materials and training program for that model. And this model will hopefully assist to serve children who are at school and continue to do this outreach work at home. I would like to mention that we're presently, I never lose an opportunity for a plug, and we are trying to hire a leader for this child and adolescent behavioral health outreach program, and we're looking for a licensed clinician to do that work. And so while we have hired some staff for the program, we are still looking for its leadership. And second, in the blue quadrant here, we continue to strengthen our outpatient behavioral health services. As part of this effort, we have innovated a client and community access team that opened in March of this past year. And this team is still in its pilot phase, but it provides translation services for all of community services clients. But we find that utilization has been strongly centered on our Island Counseling Center in our behavioral health component. And since we opened in last March, we've done more than 250 translations. And this has really helped us to build access pathways to the Brazilian population. And then rounding out our behavioral health initiatives are enhanced urgent care and outpatient treatment for substance use disorder. Urgent care provides walk-in behavioral health services and care management supports from 8 a.m. to 8 p.m. Urgent care also serves as a bridge program between hospitalization and outpatient services. Our program works very closely with Martha's Vineyard Hospital, among other inpatient facilities, to ensure that children and adults who are returning to community life after hospitalization get the continuing care that they need. And enhanced urgent care fills that void as people are waiting, oftentimes on a wait list, to enter into an outpatient service. So it's a phenomenal bridge program. And finally, our substance use treatment services include individual and outpatient group treatment. Clients in this program can also be matched, and often are matched, with a recovery coach as part of our coaching program in our Island Counseling Center. And coaches help with day-to-day help, techniques for sobriety, and linking clients with other services and supports on our island community. And then finally, our Peer Recovery Support Center is an integral part of our recovery-oriented services. The Red House, which is on the grounds of Martha's Vineyard Hospital, is thriving now with 165 peer members and daily recovery-based supportive programming. So that was a particular program significantly affected by the pandemic. And last year at this time, we had a handful of members, and now we have 165, and we have daily program occurring at the Red House. So that's an integral part of our process. And so we're making great headway at community services. All of these programs really require a solid and committed workforce, a workforce committed to a community-based approach. And these approaches really operate differently than private practice. And so this is where Charlie is going to join the conversation and speak a little bit more about the differences between community-based behavioral health and private practice and the workforce needs associated with community behavioral health. So it's my pleasure to introduce Dr. Charlie Silberstein, who will take the floor from here. So Charlie, it's all yours.
Charlie, please unmute yourself.
Thank you. Thank you, Barbara, and thank you, Beth. I'm not going to talk long because I want to leave lots of room for discussion, but I think it's important to go back and understand where we come from as an institution. And an interesting piece of history is that JFK's the last bill that he signed was the Community Mental Health Bill in 1963. And that bill had the vision that there would be 1,500 community mental health centers, like community services, around the country. Well, that was 2 years after Milton Maser had already started island counseling and MVCS. And in the early 60s and the late 50s, the vision was that we could go from private practice, where people were seen usually in psychoanalysis, and massive asylums where people were warehoused, to having a community-based treatment center that really addressed all the needs, the mental health needs of the community. And of course, mental health is much more than psychiatric illness. It involves all of the social and economic aspects of what makes people healthy. So the vision was that we could, as communities, come together to address diverse needs of populations. And so in the early 60s, community services started programs for veterans, child development program, a program for people who were suffering from domestic abuse, from problems for the elderly, problems with families, visiting nurse service, and on and on. And that's really the vision that we have fulfilled for the last 60 years at Community Services. And I think we've done it in some ways as successfully or more successfully than almost any place else. The fact is that we treat over 5,000 individuals at Community Services every year. That's a quarter of the year-round population. And the impact, of course, on other people's lives outside of the people we're directly seeing is profound. Community Services is integral to the community. And what fuels it is relationships with the community, relationships with our clients and patients, but most importantly, the backbone is the relationship that we have with each other as practitioners at the clinic and at Community Services. What happened in the setting of the pandemic was that those relationships became fractured and everything became virtual. We stopped meeting with each other in real time. Educational opportunities atrophied, and it was devastating to our organization, and a lot of people left, as is happening around the country. But that's been shifting in the recent months, and more people are coming to join our staff, and we'll talk about that more later. But Beth Mueller was mentioned, and this is a woman who's spent decades as a child and adolescent nurse practitioner at Yale. She's now commuting from Connecticut to the Vineyard to work with us. And she works virtually one week and then in person the next week. And I met Beth for the first time last week and in person, and she said, this is what I always thought mental health would be like. She said, I've never worked at a place before where there's this kind of community spirit. And that's why people take salaries that are lower than they would get in private practice, because it's exciting to work together. Not only is it exciting to work as part of the team, but the fact is that we can do things at a community mental health center that I can't do in private practice, and nor can anybody else. In private practice, we're working primarily with individuals, and at community services, we have an array of services. If somebody can't get enough food, we help them get food. We can help them get jobs and work on getting them housing. We can find ways to help somebody who's suffering with a parent or family member who's in crisis and interfering with their ability to live their lives. So what's beautiful about the community mental health model is the integration, the web of services that we are able to create together. And I think we'll come back to what we're doing to enhance retention and expansion of our staff. But what we've done recently in terms of psychiatric care is really remarkable, with the addition of Jennifer Hawken, who has been at Mass General for years, running their consultation service to medicine, and is a brilliant psychiatrist. We really have a great psychiatric staff now, and are able to do what we couldn't do 6 months ago. Anyhow, I feel like I'm talking too long, but I could go on a long time, and hopefully we'll get back to questions and discussion about what we're doing in the next half hour.
Well, thank you. Thank you, Charlie. You know, as you were speaking, Charlie, I was looking at who all is on the Zoom today, and there are so many of our community partners, people who we work side by side each day on this island, who have in their roles have felt the impact of the workforce shortages at community services. And so as I kind of peruse through our guest list here, and I'm looking at people, I'm really pleased at the work that we are doing at community services, because it's been a tough 2 years. I stepped in August of 20. It was the height of COVID, as you mentioned, Charlie. We were locked down, and there was high uncertainty, high anxiety, and a lot of stress on the workforce. And so this is difficult work for us on a good day, and doing this work in really troubled and trying times is difficult. And so I appreciate, I'm looking at the chiefs who are on this call, I appreciate the patience and collaboration that the community has afforded to our staff and our organization to be patient while we rebuild, because it is not something that happens overnight. And so this next segment that I really want to highlight are the efforts that we are undertaking to bolster our workforce, because all of the service innovations that we desire to bring forward to this community hinge on having the right people, the right people sitting in the right seats on the bus. And we have had such a focused effort on recruitment and retention over the course of the last 10 months. And those efforts are really starting to materialize. And so we have good news to share, but what I want to share is mostly what we're doing. How is what we're doing now with our staffing different from the past? How are we going to compete as an organization in this world where clinicians have so many options, where telehealth is now the new norm? How will we get people to be excited about doing face-to-face community work, clinic-based work, outreach work, school-based work, family home work? And that is the refocusing effort right now underway at community services. So we have a lot of initiatives going on, but I wanted to really focus on 4 of those. The first is a program designed to increase the practitioner pipeline at community services, create a pipeline of practitioners into our Island Counseling Center. So we have opened up the clinical residency program. We are in the 18th month of development. This came from a vision about almost 2 years ago, almost when I came aboard community services. And we have secured the property, done all the zoning in West Tisbury, and outfitted the facility, did all the upgrades and so forth. And so now we have an opened clinical residency program, and it is super exciting. That program will afford 5 slots for master's prepared clinicians for housing and a robust clinical supervision and professional development program. We have a resident who moved in at the end of September. We have a second resident expected in December, and we have the advanced nurse practitioner psychiatric student from Mass General Hospital in there as well. So we have 3 of the 5 slots presently taken, and we are looking for 2 additional residents. So I think that's really super exciting news. And that program will, in fact, be a pipeline to so many of the innovations that are underway at Island Counseling Center. Also part of our workforce strategy is attending to the existing staff. Our second core strategy centers on clinician compensation. And I know Charlie mentioned this as a reality of community-based behavioral health, and it is in fact a reality that the compensation differs, whether you're in private practice or you work in a community-based mental health clinic. It's just the way of the world. The reimbursement rates differ. And so what we can afford our clinicians differ from if you are a licensed clinician with a shingle and maybe not accepting insurance at all and exclusively private payment. We look different than that. We are accessible to all Islanders. And so over the course of the last year, we have augmented compensation at the Island Counseling Center, and effective January of 2023, we are putting forward a new compensation program that increases salaries and compensation upwards of $10,000 for a full-time clinician. And so we think this will be extraordinarily helpful in getting our talent in the door, especially. And then in addition to compensation, we look at clinical supervision and our professional development of our staff. And we intend to engage practitioners from across the Island community to augment our internal clinical supervision and professional development resources. And so our hope is that we will tie the external community back into community services and build our supportive network and safety net of clinicians. And I don't know, Charlie, if you wanted to just mention a word or two about the benefit of really tying in our Island clinical community back to community services, since so many of those Islanders, those practitioners, do have roots at community service extending decades.
Yeah, I'd love to talk about that.
Yeah.
Thanks, Beth. You know, it gets lonely working in private practice out in the community, and it's not very intellectually stimulating at a certain point. And there's been for me, something so exciting about being part of the community services team. So what we envision is that we can invite people in private practice who are out in the community to come and join us for just 5 hours a week, so that they'll have a membership in community services, so that we can learn together, so that they're teaching opportunities and supervision opportunities. And you know, I know that personally, joining community services has enormously enriched my life. And so the hope is that we bring other people on. And we've already done that with one clinician who had put in his resignation, a great psychotherapist, and he's agreed to stay part-time, which is wonderful for him and wonderful for us, and creates continuity. But you know, you can't do things in private practice that you can do as part of a team. Much more powerful when you have a team behind you. And you know, community health is all about community from people who, like you, who are in this meeting, and funders and clinicians in the community. So for the first timers, don't leave community services, remain part of our family, or join our family, and let's work together, which makes it more exciting for all of us to learn to and to deliver better patient care.
Thank you, Charlie. I think that those are really, those are really good points. And I think that the more we can connect with our influencing community in the island, the stronger our island counseling center is, and the stronger our island as well. And I think finally, you know, the last comment I'd like to make on our staffing or workforce development approach is that we really are what I consider undergoing a cultural shift at community services, and just the involvement of the staff and the development of the organization to the highest possible level. And Charlie mentioned Beth Muller. She joined our organization just a month ago, and she just has extensive experience in children's behavioral health community-based models. And she's eager to pull together a team of people and really catalyze our effort. And so the more sort of influences we have into the organization of people with these types of orientations and desires, the better the organization, the more vibrant we are in our Island Counseling Center. And so the last strategy really in the organization is to engage our staff into the innovations and the development. We really think that our work is about the work. It's about the work, it's about the programs. And so involving our staff as key contributors to our agency's development is probably the most important thing we can do. It goes much further than compensation, quite frankly. You have to have it. People need to be able to live and work on this island. That's a basic. But once we get there, how do we really attract and keep people in the behavioral health component at Island Counseling Center? It's a program on which our island really significantly depends. So keeping an eye to these best practices and innovations really inspires the continued clinical, professional, and career growth of people who enter our clinic. So it is our hope that when taken together, the full scope of our investment in innovative programs, people, and practices will help community services ultimately emerge from the COVID-19 pandemic as a strong and capable, cutting-edge organization poised for a long and sustainable, vibrant future for the island.